Senator Roberta Lang here, as well as Robert Barsel, is a high school student and here to do a presentation. So welcome.
Thank you, Chair Dennis. It's so great to see everyone today. I know that you've had a really long day, and but we want to spend some time talking to you about mental health in K-12. And sitting next to me is Robert Barsel. He's a student at the Meadows School. And I know in the last legislative session, we did a lot of work on mental health for K-12. And I think this just is going to take it a step further. We look forward to having future conversations with you, with the Department of Education, with teachers, constituent groups, and educators. And we thank you for this, and we hope that out of this committee that we could get a recommendation moving into the 82nd session. Robert.
Hi, Robert Barsel for the record. First, I wanted to say thank you very much, Chair Dennis and the entire committee, for giving me this opportunity to talk today. And thank you, Senator Lang, for helping me with this bill to bring what I find to be enormously beneficial change to Nevada. If I may, I'd like to start off by going a little bit into my background. So when I was 5 years old, my father died suddenly from a heart attack, and because of this, I was placed into both group and individual therapy. While in group therapy, I stayed there for about 6 years, and when I turned 12 years old, I was then trained in a year-long process to become a peer support facilitator. After that, I started running groups for about 4.5 years across the greater Nevada area, and originally the groups were entirely grief-focused, where it would be exclusively for children who had lost a parent or sibling. However, I realized that these tool sets could be used by everybody. So I spent a few summers, redid the curriculum, and wanted to make it more generalized. That way everybody could use it. Now I have been working at a few different organizations, such as Nevada Youth Network here in historic Las Vegas, which is an organization to offer support to underprivileged communities of colors, typically in the way of helping kids with their homework, and at Project 150, which is an organization to help unhoused youth in the realm of giving them food and clothing, where they also run workshops. I also lead groups at my school, the Meadows, which, though it has a very different socioeconomic background, there is still a large amount of need. Now, in the past 4.5 years, I have probably helped around 100 kids between the ages of 4 and 18 how to identify their emotions, articulate or healthy coping skills, the tools they need to overcome difficult social and emotional issues in a school environment. However, I realized that I've wanted to reach more people, so I decided to look at a more legislative approach, and that's why I feel so strongly about incorporating this into school curriculum so it can reach as many kids as possible. Additionally, after the pandemic, the isolation that impacted all people had an even more profound impact on children and their mental well-being. I will present some alarming Nevada-specific statistics from pre-COVID that have only gotten worse. Finally, part of the bill proposes information including the signs and symptoms of various mental illnesses in high school grades. This component of the proposal has become very near and dear to me recently, as after going through a few rounds of testing, some neuropsychological testing, I was diagnosed with a generalized anxiety disorder, and despite having many years of experience both in support groups and teaching kids how to look at their own emotions, I was still entirely oblivious to my own condition. So I'd like to go a little bit into what is mental health. Mental health is best thought of as the way a young person's thoughts, feelings, and behaviors affect their life. Mental health is a spectrum. In the same way that every individual experiences physical health as a continuum from well to ill, every individual has a mental health experience. As with physical health, mental health changes at different points in individuals' lives based on both biological and environmental factors. When mental health deteriorates substantially, mental illness may also be involved. For what is mental illness? Mental illness is any condition that impacts a young person's thinking, emotions, and mood such that it interferes with their daily functioning at home and school. A few common examples include ADHD, general depressive disorder, GDD, generalized anxiety disorder, GAD, obsessive compulsive disorder, and various eating disorders. In December of 2021, the Surgeon General issued a rare public health advisory on the mental health challenges confronting youth, warning and calling to action what he called an emerging crisis exacerbated by pandemic hardships. He cited that youth were already facing a mental health crisis before the pandemic, and that it is now a critical issue that demands immediate action. To further demonstrate the need for this, I'd like to share with you some mental health statistics. Most people are wondering, with the 2019 statistics being so bad, how has the pandemic impacted Nevada's youth? Per the presentation by the Division of Family Services on March 24th at the Health and Human Services hearing, admissions to the UMC Pediatric ED for behavioral health emergencies have increased by 65% in 2021 since 2019, and over the same period, the length of behavioral health stays have also increased by 17%. Hospital leadership reports that the increase in behavioral health patients and the acuity of patients has led to significant levels of staff stress and burnout. They also indicated the Children's Mobile Crisis Response Team hotline has received 46% more calls since 2019 and has served 24% more families. On a national level, early data indicate that the COVID-19 pandemic is further exacerbating children's mental health needs. The Centers for Disease Control and Prevention reported that beginning in April of 2022, the proportion of mental health-related emergencies department visits among all pediatric emergency department visits increased by 24% for children's 5 to 11 and 31% for children's 12 to 17. In addition, pre-pandemic feelings of sadness and hopelessness have already been on the rise from 2009 to 2019, with about a 12.2% increase. Also, middle schools have been experiencing an increase in sadness and hopelessness, and increasing from 5% from 2017 to 2019. I'd like to now go over a few of the ways that undertreated or untreated mental health concerns can impact young people at school. For example, they can have difficulty controlling attention during learning tests, they can have trouble completing their homework, and these can lead to frequent absences from school due to illness and school avoidance, trouble making and or maintaining friendships, and difficulty following school routines and norms, resulting in suspension and sometimes expulsion. Promoting mental health and wellness leads to higher overall productivity, better educational outcomes, lower crime rates, stronger economies, lower healthcare costs, and an overall improved quality of life. How does mental health affect the larger community? As of 2014, according to the American Psychological Association, mental illness among today's inmates is pervasive, with 64% of jail inmates, 54% of state prisoners, and 45% of federal prisoners reporting mental health concerns. According to the Substance Abuse and Mental Health Services Administration, 20 to 25% of the unhoused population in the United States suffers from some form of severe mental illness. Sorry about that. Crime, homelessness, children's inability to learn well in the classroom have all been tied to higher incidence of mental health. Most efforts have been reactive through hiring more school counselors, imprisoning mentally ill, funding homes for the unhoused, offering substance abuse reform programs, and the list goes on. I propose a proactive measure where we arm our next generation with the knowledge and skills to help them deal with life's difficult times, to help them recognize mental illness in themselves or others, to support efforts to get the help they need, just as they would if they had a problem with some physical condition. I would like to review the most recent Commonwealth Fund scorecard on state health system performance, which ranks Nevada as 50th in the nation for providing children with needed mental health care and 51st in mental health when compared to the rest of the nation, per Mental Health America. Nevada was given an overall grade of D+ on the Children's Mental Health Report Card and a grade of F in the following categories: access to care, substance abuse, juvenile justice, and emotional disturbance. Finally, all 17 of Nevada's counties are designated as mental health provider shortage areas. In addition, of the about 539,000 students in Nevada's K through 12, 42,000 of them have experienced a major depressive episode, and of those 42,000, 28,000 of them did not receive any treatment for their problems. This is a massive jump from, if I remember correctly, it's 2019, where it was about 23,000 students who had experienced a major depressive episode. Symptoms of depression and anxiety have also doubled during the pandemic, with 25% of youth experiencing depressive symptoms and 20% experiencing anxiety symptoms, according to the Circling Journal's 53-page advisory. There also appears to be an increase in negative emotion or behavior such as impulsivity and irascibility associated with conditions such as ADHD. In early 2020, per the CDC Household Pulse Survey, Nevada ranks 4th in the nation, with 37% of adults reporting symptoms of depressive disorder or anxiety disorder. Living with mental illness experienced onset by age 14. This number jumps to 75% by the age of 24. Approximately 1 in 5 school-aged youth experience impairments in life functioning due to a mental illness. The most prevalent mental illnesses being ADHD, GAD, and GDD. Half of mental illnesses emerge during or before adolescence, and 3/4 emerge before the age of 25, meaning that mental illness places a disproportionate burden on young people, yet fewer than half of young people with mental illness receive adequate treatment. What is the impact of mental illness? When left untreated or undertreated, coping with the pain of mental illness can contribute to self-harm, including thoughts of suicide, which is now the second leading cause of death for young people ages 10 to 24. And in early 2021, emergency department visits in the United States for suspected suicide attempts were 51% higher for adolescent girls and 4% higher for adolescent boys, compared to the same period in early 2019. Fortunately, the earlier mental health concerns are detected and addressed, the more likely the young person is to avoid the onset and or progression of a mental illness and the correlated side effects. Right now in Nevada, there are simply not enough mental health professionals to address the problems. For example, the school psychologist ratio is 1 for every 1,866 students, while the recommended ratio is 1 to 500. The school social worker ratio is 1 in 8,730, though the recommended ratio is 1 in 250, and the school counselor ratio is 1 in 544, while the recommended ratio is 1 in 250. The funding necessary to meet these minimum standards would far eclipse the cost of including curriculum to teach our students basic coping skills and empowering them so that they are responsible for their own mental health. Even if we were to meet the psychologists, social workers, and counseling staff requirements in schools, Nevada healthcare still falls short in every discipline of behavioral health providers. Right now, Nevada's language for mental health education is incredibly lacking. For example, in kindergarten, the only requirements are to identify different emotions, list a way a person shows emotions. In 4th grade, identify physical and psychological responses to stressors, and recognize how expression of emotions can vary across individuals and situations. And finally, in high school, for all 4 years, the only requirement is to investigate the relationship between mental health and physical health, and analyze the ways and decrease the risk of self-injurious or suicidal behaviors. From my own experience, I recently had the requirements for high school completed, where 30-minute sessions across 3 days. My school's counselor talked to every sophomore, and though we got all of the grade together, it was hard to pay attention because there's so many kids in one room, yet those 3 sessions of 30 minutes covered all 4 years of the requirements for mental health education. Topics I'd like to cover in the legislation are defining signs and symptoms of common mental health challenges, promoting mental health wellness and protective factors, teaching healthy coping skills and recognizing unhealthy ones, and destigmatizing mental health issues. That way it can be easier for students to discuss with each other and to recognize if they may have some mental health conditions earlier. I would now like to emphasize why mental health should be part of a school curriculum. Mental health is something that everyone will have to deal with at some point in their life. This might be getting help with mental illness, helping someone else, or dealing with stressful moments and challenges. Schools need to be portraying mental health as equally important and crucial as physical health. That starts with making mental health education a required part of education across all schools. The best way kids are going to learn to understand mental health is to educate them. To quote California Senator Portantino, who passed legislation relating to mental health in schools in October 2021, quote, "Education about mental health is one of the best ways to increase awareness, empower students to seek help, and reduce the stigma associated with mental health challenges. Schools are ideally positioned to be centers of mental health education, healing, and support. As children and youth spend more hours at school than they do at home, public education is the most efficient and effective setting for providing universal mental health education to children and youth. Historically, health education in subjects such as alcohol, tobacco, and drugs, the early detection of certain cancers, and HIV have become required because they were seen as public health crises. The mental health of our children and youth has reached a crisis point. I would now like to reiterate how improving mental health can benefit everyone. Promoting mental health and wellness leads to higher overall productivity, as it has been shown that having an increased mental wellness directly correlates to higher productivity in a work setting, better educational outcomes, lower crime rates, lower healthcare costs, improved family life, improved quality of life, and a subsequent increase in lifespan. So how have a few different states addressed teacher curriculum? As of right now, New York has invested $1.5 million since 2016 into developing a website offering curriculum options for their various school districts. While there are some free resources such as recommended books for introducing mental health as a subject matter for English, we could offer funds to utilize their website. In addition, California also has a very robust curriculum that breaks down how mental health should be taught, going all the way from kindergarten to 12th grade. While it is early in the process, I firmly believe that this would have a far-reaching economic impact on the state by decreasing homelessness, incarceration, and substance abuse problems, where Nevada could be at the forefront of improving the mental health of not only our students, but of everyone in the greater Nevada community. Thank you so much for your time, and I'm open to any questions.
Thank you very much. Questions? Yep. Senator Buck.
Thank you, Chair Dennis. Thank you so much for your well-done presentation. Has this been mandated at Meadows, or how do you implement it at the Meadows private school?
Thank you, Senator Buck. Robert Barsel for the record. So the only thing that has been mandated is those couple of bullet points that were shown there, where all that we discussed was going over what mental health is, what mental illness is, how to prevent suicide. But beyond that, there are no requirements. And in our health class, we have no discussion about mental health.
Other questions? Just a clarifying one for me. So what you're recommending is that it be included in curriculum for students?
Robert Barsel for the record. Yes, I'm recommending that it would be including curriculum for the students in a health class setting, or in lower divisions, include an overall curriculum.
And would you, well, they only do the health, they don't do the health thing every year, right? So you would only do that once during their high school career?
Chair Dennis, Senator Lang for the record. I think what we'd like to do is to get this out to let you know that we think it's important, and we think it's important for students, but that we would work with the Department of Education on where it would be best placed within the curriculum.
That's great. So you have time, and you have time to really look at that, to see how that would work. So, as well as you'd have to have the curriculum for the teachers to be able to teach the students, right? Okay, other questions or comments? Okay, well done presentation. Thank you very much. And actually, great information. It's really helpful for us to see, especially as we talk about these issues on other items that we get in here. It's really important to understand the issue. I think this has helped us to understand that. Thank you very much.